Well, we're here for session 3 of how healthy is our healthcare and why does it cost so much and how we can fix it. This slide from Martin Luther King says it all of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That is so true. It was so true when he said it in 1966. And unfortunately, it continues to be even more true today. So this is the theme throughout this presentation: to be sick and not rich is the nightmare of medical care in the United States. It truly is a nightmare for millions of people. So we're going to talk today about waste, fraud, and abuse. This one gives me chest pain, but I'll control it. A new study, this was a new study in 2019, estimated that U.S. healthcare waste costs nearly $1 trillion each year. And this is about almost 1/3 of the entire amount we spend on healthcare. And this is from JAMA and a very reputable peer-reviewed medical journal. What is waste? Well, it's the misuse or overuse of resources, resulting in unnecessary costs. I mean, everybody knows what waste is. And so how does it factor into our healthcare? Here are some examples. Performing unnecessary tests and procedures. These are very expensive, and if they're unnecessary, it's clearly a waste. Too many hospitals with an excess number of unfilled beds. We have this in the Denver metro area. The Denver Post a couple years ago published that 62% of the entire beds in the Denver metro area were occupied. Now, this occupancy's gone up a little with COVID, but normally we have a lot of unoccupied or empty beds in the Denver metro area, particularly in the southeast corridor where there's a plethora of hospitals. And this empty beds cost money, and this is passed right back on to the consumer or patients. And that's too many hospitals with unfilled beds. Freestanding emergency rooms. At one point in time, we had over 50 of these in Colorado. We're down to now, I believe, to less than 40. And we're going to talk about this a little more as we go through this talk today, but these cause a lot of waste. There's a lot of abuse involved with these, and we simply don't need all of them. And of course, medical helicopters and ambulances are here. There's a huge amount of waste in that we have too many medical helicopters in Colorado. And the more you have, the more they're used, and the more it costs. We duplicate a lot of unnecessary or expensive technology. Other countries don't have as much of this technology. They don't have as many CAT scanners or MRI machines, but they run them 24 hours a day. We have them in outpatient facilities where we may only run them 8 hours a day or 10 hours a day. And if they're in a freestanding ER, they may only be used a couple times a day if their patient census is only 10 patients, for example. We have too many overpaid administrators. This one makes me a little crazy. And we're going to go through how much these people pay themselves because they can. And these payments come directly out of insurance premiums and the bills patients are charged and have to pay. And of course, the medical industrial complex, the largest single lobbying group in our country, and they spend a lot of money. And again, this money comes out of our overall healthcare system and costs. Examples of waste. The average hospital overhead in our country is 25%. Compare that with other countries, it's about twice that. Canada is about 12%. The overhead and profit for the private insurance companies is 15 to 20%, almost always 20%. And compare that to traditional Medicare. That overhead is 3%. That's a huge amount of money that's being wasted on overhead and paperwork and unnecessary stuff that's just sucking money out of our healthcare dollar. We're going to talk about this, Medicare Advantage subsidies. It's more than 17% over and above what traditional Medicare pays to take care of the same number or type of patient. And of course, Obamacare's Patient Protection and Affordable Care Act administrative overhead. That is a huge part of why Obamacare is costing the taxpayer a heck of a lot of money. The tests and procedures we talked about, the billing and collecting, we're going to get into this from private insurers, and the cost of the doctor, the provider, and the hospital to do this billing and collection. And so a lot of stuff has been written on how can we reduce wealth in healthcare. And this one is a Harvard Business Review. This is the Health Affairs article, again, coming up with about a third of or more of what we spend annually may be wasteful. And the IOM, the Institute of Medicine, which is a very prestigious physicians group that periodically does very in-depth, well-researched white papers. And they came up with this one back in 2012. And they came up with about 750 billion wasted annually in our healthcare system. And this is certainly true today. It hasn't changed since 2012. In fact, it's gotten worse. Here's the sources of waste. Now, some of this is not, fraud is not exactly waste, although you could put it in, you could call it waste. But unnecessary services, over 200 billion. The excessive administrative costs, they come up with about 190 billion. Inefficiently delivered services because of our fragmented kind of dysfunctional system, 130 billion. Overcharges, prices that are too high, and it goes on and on. The waste is out there and it's huge. Do you really need that medical procedure? Maybe not. In fact, when the stimulus is fee for service, there is a tendency to do more procedures than is really necessary. And in fact, as a physician, you get paid a heck of a lot more for doing a procedure than you do for just spending time with a patient, taking history, examining them, talking to them. That doesn't pay well. As soon as you do a procedure, the cash register starts to ring. And so there's this perverted stimulus here to do procedures, and whether it's marginal, whether to do the procedure or not, if you're getting fee for service, you may lean toward doing a procedure. Administrative overhead. This is what I showed you last week. This is the 1/3 administrative costs. And this is hidden from view. Most people don't really think about this. They don't know about it, but they're paying for it. That's the problem. All of this is paid for by the patients or the consumers' healthcare dollars or the taxpayers. For example, in Colorado, there are 541 insurance plans offered in Colorado from 18 carriers. This is craziness, and it's expensive. Think about this. 500 different options to choose from when you're looking for health insurance in Colorado. And of course, even for identical medical procedures, hospitals get paid different amounts by different insurers. And just this past week, there was a nice article in the New York Times that covered this issue. So here's the growth of physicians and administrators. The orange is administrators, the blue is physicians, and nurses pretty much parallel that. And you can see there's a giant sucking sound in healthcare right here. And the reason this took off in the mid-90s is because of the emphasis that the Clintons had on reforming healthcare and establishing health maintenance organizations and managed care. And so all the managers got in. And then it's just gone on and on and on. And administrators, they just seem to multiply because there's money there and they got to get more money. So you don't just have the chief, you have 18 underlings collecting 200, 300, 400, 500,000 a year in salary. And most of them not doing much. It costs us in this country $685 billion a year to subsidize health insurance. These are tax dollars, and we went over a lot of this last week, to subsidize health insurance, directly or indirectly. Obamacare, the subsidies there are well over $300 billion a year just for the Obamacare marketplace. And here's the difference between the private insurance subsidy, which is the gray line, and Medicaid. It would be much cheaper to the taxpayer to put everybody on Medicaid rather than to subsidize their private insurance policies with all of the copays, deductibles, and things that cause people to go bankrupt or get surprise bills. Now, this Medicaid would have to be fixed too, because their payer rate is very low, and that would have to come up to Medicare, which would be somewhere up here, but you would still save a huge amount of money if we weren't paying all these tax dollars to subsidize the private insurance marketplace. We're going to get into this next week, but the Yale study said Medicare for all would save $450 billion, and more importantly, prevent nearly 70,000 deaths a year and cover everybody for health insurance with health insurance. Just filing the paperwork in this healthcare dysfunctional, fragmented marketplace is $800 billion a year. There's an army of people employed by the insurance companies to process their claims and figure out ways not to pay the claims, figure out ways to discount the payment. And on the other side, you have the physician's office having to file the bills, send the bills out, dispute the fight with the insurance companies to get paid, have to get pre-authorization for some procedures and tests. And all of this takes time and money. In fact, the average private practicing physician now pays $99,000 a year just to do his billing and collecting. It's just absurd. And this is the reason a lot of doctors are dropping their private practice and going with hospitals or private equity funds to cover their administrative overhead, which also contributes to the problem with costs in healthcare. Now, these administrative costs are going up dramatically. Let me go back here. This is a 2010 slide, but the proportions are probably pretty similar here. You can see us compared to some other countries. And the best comparison is with Canada, where their administrative overhead is, hospital overhead is half of what ours is.
Jeez, crazy.
Half of the administrative costs for providers are billing and insurance related expenses. And it's actually probably a little more than that. And you can see the total administrative costs for physician groups is 27%. And billing and insurance related costs are half that. And hospitals, a little less, but this is significant. Billing and insurance related costs per patient encounter. Inpatient surgery, it's expensive to do that billing because it's kind of complicated. Ambulatory surgery, a little less. Then hospital stays, emergency department visits, and you can see all these numbers really add up quickly. The overall administrative cost per capita, comparing us to Canada, you can see how much it's 3 times more.
Crazy.
Hospital billing and administration. Look at this difference.
Gosh.
856 for us and 190 for Canada. They are so much more efficient. And the reason they're so much more efficient is I believe they do global-based budgeting for their hospitals, and we're going to get into that. Private insurer waste, a private insurance company. The claims processing, a large number of people paying them a lot of money to do this, to minimize their payments. They are always out there negotiating discounts with doctors and hospitals, creating their own network, and getting the best deal. Marketing. We showed last week that about $30 billion a year are spent just in marketing these kinds of services. Lobbying, we're going to get into that later. The huge salaries to their CEOs and administrators. And remember, the primary goal of a private insurance company is to make a profit. It's not to provide healthcare. That's secondary. That's the way they make a profit. And this is accomplished by ensuring the healthy and avoiding the sick, which Obamacare kind of took away that game to some degree by not allowing them to deny coverage for pre-existing conditions, but certainly not completely. The paperwork, this is just the health insurance paperwork. This estimate back from 2015 is $375 billion a year. Here is physicians interacting with insurers each year. In Canada, the cost is $22,000. In the US, $82,000, and now the current number is $99,000 a year. Just to do the billing and collecting, the amount of time it takes a physician away from medical practice to deal with these hassles is incredible. In Canada, they don't have these hassles. They could spend much more time just taking care of patients. The Affordable Care Act has added billions to our bureaucracy. And we went over that, some of that last week, but the administration of the exchanges and the funding of both federal and state exchanges is very expensive. The subsidies are what's really expensive in terms of administrative overhead for Obamacare. And just the subsidies alone are now over $300 billion a year. Here's a diagram of how Obamacare works and the subsidies. You can see it's a little complicated, and the more complicated it is, the more expensive it is. And of course, here's the amount they spend on marketing. Just the healthcare industry alone spends, I'm sure, over $30 billion a year on marketing. And you see these ads incessantly on television all of the time for Medicare Advantage, for different types of health insurance, obviously for prescription medications. And all of this stuff is really expensive, and of course, comes back to the consumer paying for it. Here's a study that showed that Medicare in 1 year, 2019, spent $2.8 billion on drugs that other wealthy countries wouldn't cover or recommend, because they set it up so that Medicare can't say no, like they can in the national health system in Britain or in Canada. Medicare basically is expected to pay for every drug that's been approved that a physician wants to prescribe. And that is just craziness. We need a formulary. We need control of this. We need to establish protocols which are evidence-based as to which drugs we should pay for. And when you have 5 drugs in a given class, you don't need to have to pay for all 5, because some of them are very, very more expensive than others, and they're basically the same drug. We're going to get into this, Medicare Advantage. That basically is turning your traditional Medicare over to a private insurance company. And these private insurance companies are very good at overbilling Medicare for what they do. And we're going to get into some details of that in a little bit. Right now we will, actually. So we'll cover Medicare Advantage, and then if there's any questions or comments, I'd like to hear them. So again, Medicare Advantage is private insurance, okay? The overhead for traditional Medicare is $147 per patient. For Medicare Advantage, it's $1,450.
Wow.
The services provided medically are no different. In fact, they may be more limited in the Medicare Advantage programs. But look at the difference. And the federal government and Medicare has agreed to pay this difference. I mean, they set up Medicare Advantage, so they're going to transfer a capitated amount to a private insurance company for each patient that signs up for Medicare Advantage. And this in Colorado, that's approaches about $1,000 per year. It's actually about $11,000 annually, $1,000 per month, a little less than that. And that's guaranteed payment, whether the patient is sick or not, whether it uses any services or not. In addition to that basic transfer, they transfer the 17+% for administrative overhead. They're willing to pay, and I have no idea why they agreed to this. They're willing to pay the administrative overhead of a private insurance company. I mean, this doesn't make any sense, but that's what they do. In addition, we're going to get into their risk adjustment, which is where they commit all the fraud. And we're going to get into that shortly. Any questions or comments about anything we've discussed so far? Any questions?
Go ahead if you'd like to ask a question or make a comment. I'm interested, Vince, because I don't know. The capitated payment that the insurance companies get for managing Medicare Advantage, do they also get on top of that a per procedure fee or not?
No, the capitated amount is to them to provide whatever necessary medical care is needed by that given patient.
Wow.
So no, they can't turn around and start billing fee-for-service for expensive procedures. However, they do have a risk adjustment, and we're going to get into that now.
Okay, I had another one question. I wondered if other people have seen this new commercial from Lilly, the drug company, that starts out by saying it costs just the same to be sick, whether you're poor or whether you're wealthy. Illness doesn't know. And I thought, oh my gosh, you cannot tell me if private pharma is doing that kind of commercial. They're trying obviously to make people feel better about big pharma. But to me, it was very offensive. I didn't know.
Well, the other commercial that's just started airing in the past week or two is to scare people about the proposal in the new upcoming soft infrastructure bill, where they're going to allow Medicare to negotiate prescription drug prices. And the scare part of the commercial is they're implying that Medicare is going to start rationing their drugs, and you won't be able to get the drugs you need if Medicare can negotiate prices. They've started on that already, and it's out there.
I saw that, the Nancy Pelosi socialist plan. I've seen that.
All right, so let's talk about fraud. That's intentional deception, and it's illegal. Examples, and we're going to get into each of these: Medicare Advantage risk adjustment, hospital and provider billing, insurance companies, particularly billing Medicare, the prescription drug marketing and prescribing, kickbacks to providers from hospitals, from dialysis clinics, from hospice centers, from medical device manufacturers. There's a lot of that going on. Hospice and other home healthcare scams, addiction treatment scams, and medical equipment and ambulance scams. Everybody's out to scam. You're going to see some people go to jail, but they're the little fish. They're often the providers that have been doing bad things. However, the companies that do the big fraud are too big to jail. They don't go to jail, they just pay fines, but nobody goes to jail. And that's a big problem in what's happening now. Let me get this to advance. Let's first talk about, this is an older slide in 2014. They said it was 272 billion. It's far more than that a year. And Medicare is the primary target. And the reason Medicare is the primary target is they're very good about paying bills. They pay now and they ask questions later. And it's good from a provider perspective to be able to get paid in a reasonable, timely fashion without any hassle, but it also is a setup to commit fraud. Let's first talk about hospital billing fraud. This is a big issue. And the way people commit billing fraud is they do what's called upcoding. You code for all of the things that you do as a provider and as the hospital. And upcoding is you bump the code up above what you really should be entitled to in terms of the services you provide. And it's not easy to detect necessarily. You have to really have people who can get in there and do very stringent audits, or more recently, a lot of this is discovered because of whistleblowers. Whistleblowers have done a real service here. But the landmark case for hospital billing occurred in 2003 when Columbia, which was a for-profit healthcare corporation that had a lot of hospitals throughout the US and had 4 or 5 in Denver at that time. It's now called Health Corporation of America. They paid a $1.7 billion fine and had a criminal guilty plea for upcoding and fraudulent billing from multiple hospitals in their system. Of course, nobody went to jail because they just pay this civil penalty. And the CEO of Columbia Hospital Corporation at the time was this guy. Recognize him? Became, after this fraud case, he left Columbia, got paid a huge payout when he left, subsequently became the governor of Florida, where he blocked Medicaid expansion that came through original Obamacare and denied a huge number of people in Florida, over 1 million people, basic health care they could have gotten by qualifying for Medicaid. And in his deposition on this case, he took the Fifth Amendment 75 times. He claimed also, I believe, that he was just a CEO. He didn't know his underlings were committing, fraudulent billing. I mean, if you're just a CEO, why would you know that? I mean, this is, and these people end up getting rewarded for doing the stuff they do. United Healthcare consistently has overbilled Medicare by billions. There's the behind the scenes stuff. Health insurers use cash and gifts to sway which benefits employers choose. Employers often will employ somebody as a broker to decide what the best deal would be for health insurance for their company, because they got to renegotiate this like every year. And they think they're getting an honest broker. But what happens is these brokers often get kickbacks from various insurance companies to steer consumers to their company. And so there's a lot of that going on. Oh, this one. Anybody who's on Medicare has gotten, not as much recently, but used to get phone calls every day almost, asking if you have any knee pain or back pain, and you know how they have these new braces out there, and they would be wonderful, and they would really take care of your problem, and we can get you these over the phone, and they connect you up with a provider, either a PA, an NP, or a physician, who over the phone talks to you for 2 or 3 minutes and then authorizes all these expensive devices. Well, they got busted for this, but it's still going on. Here is overbilling by United Healthcare again. Here is money laundering scheme in Florida. Florida is a hotbed for fraud. Here's upcharging of Medicare Part D. This is the drug part of Medicare. And insurance kept the extra cash. Here's a Texas hospice that this guy went to jail. And again, this is relatively small fish in terms of fraud, only 150 million. And he was falsely telling thousands of patients with incurable diseases that they had only 6 months to live, so they could get admitted to his hospice centers, where he could then bill Medicare for this, and where most of them went home. They didn't die. Here's false this one was horrible. 325 million, where he falsely diagnosed patients having rheumatoid arthritis and treated them with very expensive toxic medications. I mean, this guy should be in jail for the rest of his life. Here's the Medicare Advantage one. They overbill taxpayers by billions every year, by billions. And here's the way the scam works. And in fact, I was offered this job at one point in time. HMO's house calls are a new upcoding scam. What happens when they enroll a patient in Medicare Advantage? The insurance company will do a survey. They wanted me to go out and do house calls as a doctor. And they said, but you don't have to examine the patient. You just have to ask them a series of questions. So you go out with this comprehensive questionnaire and you say to somebody 65 years old, do you ever have any joint pain? And everybody, of course, is going to say yes. And so the insurance company will then code that as chronic arthritis. And that is a risk adjustment. Medicare not only agreed to the 17% plus administrative overhead to pay, they agreed to adjust how much they pay per patient if the patient has pre-existing or serious health conditions that's going to cost a lot more money. And so what the insurance companies are doing is they're doing this coding scam. Let me get here. So you seek an unimportant diagnosis, mild arthritis, they get no treatment. The extra diagnosis allows the insurance companies to upcode, and it's costing Medicare over $300 billion a year. There were efforts to allow this upcoding stuff, but of course the industry lobby killed that in Congress, and they can't outlaw doing upcoding through house calls, and it's just horrible what's going on. This is United Healthcare just lost an appeal on a Medicare Advantage overpayment suit from CMS, but actually the Justice Department does the suing. Another Medicare Advantage grab. Kaiser has even gotten into it. Kaiser's generally had been kind of a good guy out there, but here in California, there's allegations from a whistleblower that they were doing this upcoding as well. And now there's a government lawsuit against Kaiser. This fraud occurred in, this company is based in Denver. It's one of the two big dialysis providers in the country. And remember, we talked about it the last couple of weeks, in that the kidney is the only organ in the body guaranteed health care, because Medicare will cover any patient except an undocumented person who is on chronic renal dialysis. And DaVita is one of the two big companies that provide dialysis. They had to pay $389 million in this suit. There are 1,900 of these centers in the US that DaVita has. They're guaranteed payments from Medicare, which is why they're so lucrative. They had multiple settlements, 3 fraud suits within about a year or 18 months, totaling over $1 billion. Nobody, of course, went to jail. And this is what I mentioned last time, is go to YouTube and Google or put in John Oliver dialysis, and he did a great video on DaVita committing fraud. And just within the last 6 months, the former head of DaVita, when all this fraud went on, named Kent Theory, is now being charged with collusion as part of his what he was doing when he was CEO. Here's kickbacks to doctors. Again, all these kickback cases, one of the DaVita fraud settlements was for kickbacks to doctors to refer them patients. Here's kickbacks for spinal surgery stuff. These doctors or the company giving the kickbacks, they pay fines. But I haven't seen any of these cases where the doctor went to jail or lost his medical license. That needs to start happening, because that's going to be the best way to stop this stuff. Here's a hospice paying 2.4 million kickbacks to doctors to get referrals, and these are often fraudulent referrals. Doctors will refer patients to these expensive hospice centers of patients who really don't qualify for hospice. But again, because Medicare or private insurance will generally pay for hospice, they get admitted. And then they miraculously get better, or they don't die and they get discharged. And this is where the fraud comes in. Here's some other Medicare, Medicaid fraud stuff. It's pretty incredible what's going on out there. We're going to get into the pharmaceutical company fraud in now. Are there any questions or comments? And then we'll take a break. No questions, no comments. Okay, let's take a 10-minute break.
Okay. 10-minute break, everyone. Come back at 6 o'clock. Bring friends.
Yeah, Donna, we might be able to go back and go over the beginning of the talk where my other phone interfered with things, and I could
Sure,
clean it up.
that's just fine. That's just fine.
Okay.
And I can take out, Vince, during when I edit the recording, I can take out that section.
Okay,
we're
good.
dealing with that.
Okay, let's take a short break.
Sorry. I'm unmuting people. Now we'll wait a few more minutes. Yeah, I can edit these things out. Any of the breaks we have, Vince, I can edit out and so forth. And we have had a good number of views of the previous 2 sessions on YouTube. And
We did.
And that's good news that people are availing of taking
Good.
advantage of those.
Good.
Yeah. And those will get out even further when we have a full set. We did have a question from Debbie in Ohio. She asked if we were going to make all of the slides available, and yes, we are. We're putting them together in a whole package for the whole series, and they will be on our website, and they also will be available to you if you need them by email. So there'll be a nice package deal, and you can use, I think, Vince, is just, you're fine with people using the slides, right, Vince?
Yeah.
Okay. I know many of you know I worked for Columbia Hospital as a Victoria Hospital in Miami, Florida, when Rick Scott was a new and up and coming, exciting executive. And I promise you that he would send the problem that I got involved with, that I reported to the government, was that we were only to make soft asks on Medicare deductibles when patients were coming in to the front desk. And I was the billing manager, so that's why I was involved in this. And if the patients didn't have that money, we weren't to stop them from getting their care, obviously, which I thought was wonderful. But then afterwards, what we were told to do, because the way the system works is that the hospital or provider must use due diligence to attempt to collect those deductible portions. And if and when you've used due diligence and they haven't been collected, then you can submit that to the government to be repaid for that essentially bad debt. Well, Mr. Scott and his accountants in the hospitals would ask that we print out collection letters to all of those patients, place them in the patient files, because we still used hard copy files at that time. That's how long ago it was. But never mail those letters. And then he would send our CFO to Tallahassee to pick up the check that was a reimbursement for the bad debt. And that was sometimes hundreds of thousands of dollars. And I eventually walked off the job because as I was new to medical billing, and what I read, it said that if you knew or should have known fraud was being committed, you could be guilty. So I walked off.
But that was before the whistleblower protection law,
yep.
where you could have gotten a cut of that action, you know.
Yeah, well,
whistleblowers have done very well in some of these suits.
But it was just horrifying.
But Medicare was reimbursing for the deductible or the copay?
Medicaid and Medicare, both.
They don't do that anymore.
Medicaid would come through the state. It was processed through the state. That's why they'd go to Tallahassee.
I don't think they do it anymore. But
now, I don't know if they do it anymore, but oh my gosh. And I was literally told, I said, we can't do that. And the CFO said to me, it is your job to do it. I said, well, then it's not my job. And I packed up and walked out. It was pretty scary because it was right before Christmas. And oh my word, I told my family, I said, I can't do that. It's terrible. I can't. So that's what happens. And that was many years ago. That was 1990.
So you leave your job and Rick gets promoted, huh?
That's right. Absolutely. They also wanted to make sure that I could not
let no good deed go unpunished.
Yeah, no unemployment either. They said she's not eligible for unemployment. She walked off the job. I thought, oh, we'll see about that.
Oh.
But where is
all right,
now?
We can get started again, I think, Donna.
Absolutely. Go for it, Vince.
All right, let's talk about pharmaceutical company fraud. I think everybody's heard one way or another about this. The most recent huge issue has been with the Sacklers and OxyContin and Purdue Pharma. It's rampant and it's outrageous. And from a pharmaceutical company's perspective, they just view this as the cost of doing business. Because again, I can't find a single pharmaceutical company executive or employee that has gone to jail for this huge amount of fraud that their companies have been committing. So they just think this is the cost of doing business. And the most common way they commit fraud, probably 70–80% of the judgments against the pharmaceutical companies, is for what's called off-label marketing. So when the FDA fully approves a drug, for example, like the new vaccine, they approve it for specific indications. For example, a new drug to treat schizophrenia or acute psychosis and bipolar disorder in adults. It's approved to treat schizophrenia, psychosis, bipolar disorder in adults. Well, this drug then is marketed by their sales representatives to not just treat the indications for which it was approved, but they go out and they say, hey, you know, we're hearing from doctors that this is working on children, so you might try it on kids. Or more importantly, if you have a nursing home or long-term care patients who are having difficulty and are disruptive, this is a good way to calm them down. So a lot more of the drug is being prescribed off-label, and a physician can prescribe a drug off-label and not really get into too much trouble. But if the drug company is promoting it for off-label use, then that's fraud, and they get busted for it if they get caught. And this could put patients at significant risk. If you start using drugs for indications that it wasn't approved for, that can do bad things to patients. And because doctors often get their only education about this drug from the salesperson, it's not a good situation. And here's just in 2012, these are the civil fines against these drug companies in 1 year. And you can see it's almost all illegal marketing. There's one here for physician kickbacks. But, you know, Glaxo paid $3 billion. They probably made 10 or 15 billion in profit from the illegal activity that they were doing, promoting their drugs. Here, I try to find out how much fraud settlements there were. And this is kind of a busy slide, but if you look, this was done in, I think, 2019. Since 2000, 56.4 billion was collected in fraud settlements from 957 instances or cases. And you can see here are the big offenders, Purdue Pharma being right at the top. And they're all the major drug companies in the country have paid over 1.6 to 9 billion a year. And remember, all the fraud is not detected. And these dollar amounts are far less than the profits that they've made from the fraud that they've committed. And of course, as is the case with Purdue Pharma, how many people have been killed by what they've done in terms of how they marketed their OxyContin? And nobody goes to jail. That's what has to be changed to put a stop to this. And the other thing is, Medicare does not have enough investigators to go out and investigate the fraud. And they could have a huge return on their money, just like the IRS could, if they hired more people to investigate these and go after these companies. And the settlements they would recoup would be far in excess of what it cost them to do the investigations. So that's where we're at in terms of billions of dollars. Let me go back here. Here's the EpiPen set. There was fraud here. Remember when the injectable epinephrine went from $30 or $40 for an injectable syringe to auto-injectable syringe to $300 overnight. There was fraud committed here. And that's the settlement.
But now pharma gets to be the whole marketer of vaccines, right?
Pardon me?
Now pharma gets big money from the vaccines too.
Oh, yeah,
COVID,
yeah, you're right. We're gonna, here's the, so all these huge fine settlements and lawsuits are just routine business. It's like getting a speeding ticket. You pay the fine and you keep on going. And here's the fine for this one drug from AstraZeneca was 2.4% of the 21.6 billion they made in sales from the drug. Pretty good return on your money when you can pay 2% in fines and make the other 97% in profit. The drugstores are in on the act. Here's Walgreens overbilling the government, and they got busted. Everybody's in on this. Here's physicians and the pain pill stuff where they just prescribe boatloads of narcotics to people, never even see the patient, just automatically do it out the door, and they get busted. Here's another opioid scam. It's just, what's going on out there is really, it's criminal, but it really isn't. It's civil. There's civil cases that are brought against these people. They pay a fine and they keep on going. Now we're going to get into abuse. This, in contrast to fraud, abuse is not illegal. Abuse is legal, but it's abuse. It's pervasive throughout the healthcare industry. It's mostly excessive, unjustifiable charges for prescription drugs. I mean, overcharges for prescription drugs, for ED visits and hospitalizations, for provider fees, for health insurance, administrative overhead, and salaries. This is all legal stuff, but let's see how rampant and how outrageous it is. This is what I recommended to you guys last week, was to read this Sentinel Time Magazine article from 2013 that focuses on the outrageous hospital charges. The entire issue of time was taken up by that. The way hospitals inflate charges, one of the ways, is they charge what's called a facility fee. That started with just a facility fee for their emergency department visits, where they said we have to tack additional money onto your charge because we have this place open 24 hours a day with expensive equipment, with full staff of doctors and nurses and everyone else. And whether we, see, 20 patients in 24 hours or 100 patients, it costs us the same amount of money to staff it. And so we have to add this additional charge onto your bill. So it used to be pretty much only for emergency visits. But then they started expanding these facility fees. So if a doctor or a doctor's group decides to stop their private practice and go and become hospital employees for their primary care practice, for example, The patient that's been seeing the same doctor every year and paying $80 or $100 for his annual visit now goes to the same doctor who's employed by the hospital and gets a bill for $500 or $600 for exactly the same type of visit. And it's because the hospital, because they're hospital employees, adds a facility fee onto the charge. And then they've expanded this further. And that's one, they've expanded it further to go to freestanding ERs. And we'll get into that in a minute. But then there are the hospital charges. Are they based on actual costs? And where can you find these charges? Well, they're all there in a thing called the Charge Master, which is this huge volume book of charges for everything that a hospital can charge you for, from an aspirin tablet to, major surgery. It's all in the book, but these charge masters are not public. Okay. There's been efforts, actually the Trump administration made an effort to make them go public with these things. And it's some hospitals have, others haven't, but they're hard to get to. It's not really transparent or accessible easily, but I'll tell you how to get to it in Colorado in a minute. So this is the X-ray of non-transparency, healthcare costs. People get sick, they have an emergency, they go to the hospital, they get the care. They can't go shopping. They can't find where the best deal is, but then they get hit with these outrageous bills. And a lot of it is lack of transparency. Here's an example. This is a story by, again, Chris Vanderveen, who was doing a lot of nice investigative healthcare reporting for Channel 9 News some years ago. Stopped doing it a couple of years ago. He doesn't do it anymore, but this was buyer beware. This was a charge of $441 for a single bag of normal saline, which is salt water that you put in the patient's vein. The bag cost the hospital probably $3 or $4, maybe $5, I don't know, but less than $10. And they charged $441 for it. This came from Swedish Medical Center, Health HCA Hospital. Here's one just last month on NPR. They do a monthly bill with ProPublica and Kaiser Health News. And don't confuse Kaiser Health News with Kaiser Permanente. They're totally different. Kaiser Health News does a lot of good stuff and a lot of nice research and publications. But anyway, this was a lady who went into a Centura hospital in Colorado Springs with abdominal pain. And she had a bunch of tests and it turned out to be nothing serious. But she had some nausea and some pain. So the nurse drew up anti-nausea medicine, which she was billed for separately, and injected it into her IV. And that cost $722 to draw up the medicine from the little bottle into the syringe and inject it into the IV. She also had the same thing with the pain medication, injected into her IV. So there were $2 for two charges, each for $722 for injection of the medicine intravenously. And the charge for the medicine was separate. I hope the nurse was getting, at least half of this. You think the nurse was getting paid commission for these injections? This is how outrageous this stuff has gotten. It's just insanity out there. And the only way you catch them is people should demand an itemized bill. And then, but the average person doesn't know. I mean, this obviously was easy for the average person to know it was outrageous. there's another cottage industry that's developed around this. You could hire somebody to negotiate your hospital bill down, and they'll either work like a lawyer, or they'll take a percentage of what they saved you, or they get paid by the hour, because people get these outrageous bills, and their insurance company, if they're either uninsured or the insurance company will not pay it because they're gone out of network or for whatever reason. This is how crazy things are out there. And this is just, here's another one. There's a child at Children's Hospital in Denver. She was there seeing a ENT doctor for some other procedure, which he did. And then because of her age, he said to mom, hey, she probably wants to have her ears pierced. Would you like me to do that for you? And mom said, oh, yeah, sure. So he pierces the kid's ears, and the hospital bills him an operating room charge of $1,877 for this piercing a child's ears procedure. Of course, the bill went away when it became public, but it shouldn't have to become public. Hey, this is a doctor working in an urgent care clinic. I think it was in Texas. I'm not sure what state. And he was having some symptoms, and he thought he might have COVID. So he went into his own urgent care center to get a COVID test. And the urgent care center was probably owned by a hedge fund equity company. And so they took the culture, and they not only send it for COVID tests, but they send it for all these sophisticated diagnostic studies that were overly inflated in prices. And he gets a bill for $11,000. Just all he needed was the straightforward COVID PCR test. Now here's where the abuse is. If you look at the hospital charge to cost ratios, this came from, I think, Nurses United did this study. And what they did is they looked at the charges hospitals charge and compared it to what Medicare would charge for the same service. And you can see these charge to cost ratios, how dramatically they've been increasing year to year to year. It's now averaging almost 4 to 1. So what the hospitals charge is 4 times more than what Medicare would pay for the same service, which is probably the real cost. Here's the top 10 in Colorado hospitals, and you can see the charges range from the North Suburban is 700%, which means their charges are 7 times the cost. 7 times. And what's obvious on this slide is all of there's 1, 2, 3, 4, 5, 6, basically all but one, or all of the HCA hospitals in the Denver area are on the top 10 charge to cost ratios, because these are the for-profit hospitals. And that's the problem with for-profit hospitals. One of the problems. I just took one charge. And you can get to these charges now. On the bottom lower end of this slide is CHA. That's the Colorado Hospital Association website. You can go to their website. It gets a little tricky, but you can find the hospital charges for any procedure from every hospital on this website. And so I took uncomplicated laparoscopic appendectomy, which is generally an admission to the hospital for 12 to 24 hours. Patient goes to the operating room, has a couple little incisions made in his abdomen, and the appendix is removed through a laparoscope. And the recovery is very quick, and the patient generally just goes home. within 12 to 24 hours. And these are the hospital charges, not the doctor, the surgeon, or the anesthesiologist charge. And you can see the range here. The best bargain is Arkansas Valley and La Junta, where it's $22,000. If you end up at Sky Ridge and you're the young guy who says, I'm healthy, I don't need health insurance, and walks in there and has appendicitis, this is his hospital bill, $95,000. This is how stupid this has gotten. This is just incredible. Now, if you have health insurance and they have a contract with that hospital, they're going to get a substantial discount. But if you're uninsured or you're out of network, you're going to get hit with these charges. Denver Health's a bargain in Denver, only $32,000. You get to University of Colorado, they're up to $59,000, and then it goes on up from there. So this is just amazing. And all of the charges, I went to the website and checked out a whole bunch of procedures and things, and they all have this kind of a wide range. And it's just amazing what's going on here. Here is the bottom line bill for a knee joint replacement at St. Joseph's Hospital from a Kaiser patient. And you can see the total bill was $69,000, but the contract Kaiser has with the hospital is to pay, what is it, $11,000? I have it blocked out here. Basically to pay 25% or less of the bill, the actual payment here, Kaiser. And of course, the patient paid a copay of $300. So this is how crazy these billings have got. And if you go through this, I didn't want to go bother you with all of the items on here, but there's crazy stuff here. Here's physical therapy. This means the nurse got the patient out of bed and walked with the patient up and down the hall to keep them moving after the knee joint replacement. And look at the charge there. I wonder how much of this the nurse got. And these charges just go on and on. It's just insane. Here's the latest scam that they finally published. I knew it's been going on, but it is rampant. And it has to do with trauma centers. It's why everybody wants to become designated as a level 1 or level 2 trauma center. Because if you have this designation, you can do what's called trauma center activations. And that means when the trauma patient is coming in, if you're concerned they may have something serious, you call it activation. And so what happens is a team arrives in the emergency department to meet the patient. In a level 1 trauma center, that includes the trauma surgeon on call. It will include representatives from the lab and the blood bank and a team of people. And they then right up front charge a trauma activation fee. So HCA hospitals have gotten into the act here. The nation's largest hospital chain cashes in on trauma centers. And in fact, you know, this could be so absurd that one of the hospitals in the Denver area, I've heard, will automatically make anybody over age 65 who sustained any trauma a trauma activation. So I could fall and break my lower leg or break a hip and have no other trauma at all and get taken by ambulance to that hospital, and then trauma activation charge occurs. And here's the difference between the for-profit hospitals charges and the average charge in those states for trauma activation. You can see the incredible range. Look at Nevada. In Nevada, $53,000 for a trauma activation. And the other hospitals are very expensive too. Florida, $28,008. Now in Florida, they looked at the HCA trauma activations in the Florida hospitals. And guess what? 25% of these patients who came to the ER, called the trauma activation, went home the same day. This is how bad this has gotten. This is just, at Denver Health, we had very stringent criteria for when we would call a trauma activation. And I'll tell you, none of these patients in my 32 years there ever were discharged home the same day.
Hey, Vince, Don Parsons here. Do these hospitals have a total leeway in setting their prices, or is there some kind of national standard in the emergency?
No, as far as I know,
center?
each hospital can set their own fee for a trauma activation. And more importantly, they set their own criteria for when to call it. And that's where the fee is outrageous sometimes, but the real abuse comes in for calling it for no or very marginal reasons. And, it's just, this is just crazy. Here's Coloradans pay more as hospital building spree leads to empty beds. There was an article in Denver Post several years ago that said the bed occupancy rate at that time in the Denver metro area, after 4 or 5 new hospitals were built, was 62%. So 1/3 or more of the hospital beds were unfilled. But these still cost money. And this construction boom, and if you look at where these new hospitals were built, and you look at the zip codes, and you look at the incomes in those zip codes, all in the very more affluent areas of the suburbs. Freestanding emergency rooms, we were over 50 of these in Colorado at one point in time. I think we're down to below 40 now. They're often now owned by private equity funders. The doctors who work there work for these equity funds, and they're almost always out of network. So when a patient goes there with health insurance, even though the freestanding emergency room may have a hospital name attached to it, the physician they see often is out of network, and they get these huge surprise bills that way. They also all of them charge huge facility fees because they're affiliated with a hospital, and the hospital says, well, this is one of our emergency departments or rooms. So they add these huge facility fees onto it, and the bills are just outrageous. Now, how can this be controlled? Well, there's something called a certificate of need. In Colorado had this until the early 80s, I believe, when the legislature repealed it. And you can see the gray states have no certificate of need program. The others have one form or another. I'm not sure how effective these are in most states, but in Colorado, we have none. And here's how that worked. When I first came to Denver Health in 1977, they were Marvin Davis, who was a wealthy oil man, contributed, I don't know how many, a couple $1 million to Denver Health. And one of our administrators, who wasn't the sharpest tool in the shed, decided we're going to build this new little hospital on our campus, and it would be a geriatric hospital, which sounded good. We were going to admit older patients with geriatric problems, and maybe we could even do research. So they built the whole hospital, design it as a geriatric hospital, but they forgot to do something. They forgot to go to the state and get a certificate of need. And what that meant back then is the state would say, well, show us that there is a shortage of hospital beds in your immediate area. And if there is, then we would grant it. If there was no bed shortage, we wouldn't. So Colorado denied the certificate of need, and this building was never opened as a hospital it was built for. That's the way you can actually control costs. So if a hospital wants to build a new hospital, 10 miles away to compete with their competition, or wants to add a lot of hospital beds, the question that's asked, is there a real need for this? And if there isn't, it gets denied. And this actually saves significant amounts of money. The other way you could do this would be global-based budgeting of hospitals. And we'll get into that next week. But this is the certificate of need, and that would help. Although, I don't know, here's another issue that some people have done some reasonable research on. I think the number is like $25 billion a year in tax breaks going to not-for-profit hospitals, because they pay no real estate tax. They get all kinds of tax breaks from the local community and sometimes from the state. In return, they're supposed to provide a certain amount of indigent care. And that's not always what they do well. And so the question people are asking, are these tax breaks worth it? Are they deserved? And this one we talked about last week. Private equity is ruining American healthcare. These are private equity firms that are purchasing doctors' practices, they're purchasing helicopter systems, ambulance systems, they're buying hospitals. And this is how much they're increasing. This is through 2019. And these firms, their whole goal is to make a profit. And they realize there's a lot of dollars in healthcare they can get access to. And then they do this. Here, they're buying a lot of hospitals, particularly some of the smaller rural hospitals who are in trouble. They come in with a bunch of cash, say, we're going to bail you out. They buy the place, then they run it into the ground, and then they close it. And that's just horrible what's happening. And they do this with a lot of businesses, actually. And when they buy up a physician practice, for example, emergency physician groups in Denver, the two big hospital systems, most of their contracts are now with equity firms, the physicians' contracts. They take over all the administration and all the billing for the physicians. So now they bill for the emergency physicians or the anesthesiologist or the hospitalist or the radiologist. And if you're controlling most of the hospitals in a given geographic locale or both of them in a smaller city, you are in a good position to negotiate with insurance companies to say, we're not going to give you a discount, or we're not going to go in your network at all. And then the patient's the person who takes the heat from this, because now they're out of network. The bills are outrageous. Their insurance company won't pay their full bill, or sometimes their bill at all. And the patient gets stuck with this, and this is the surprise medical bill that often leads to bankruptcies. And again, these upcharges that are going on are not generally being passed back to the doctors. They're going directly to the equity companies. And it's going to ruin healthcare if it continues, because it's going to make it virtually unaffordable. Now let's go to another one here. Oh, air ambulance. We talked a little bit about this last week. Two equity firms control the majority of air ambulances now in the country. They do the billing. They're billing more for patients than ever. The average charge went from about $8,000 for an air ambulance ride to $40,000 now. Here's a message. This patient had a stroke. I think it was in Nebraska, somewhere in the Midwest, and wanted to go back to Boston, I believe, to get his care. There was some sophisticated care that he needed. So they put him in a fixed wing, and then they landed somewhere. Then they put him in a helicopter, and they charged him $474,000 for the medical flight. Here's one where the air ambulance bill was more than the surgeon's bill to do a lung transplant on this patient. And private insurance companies often don't have contracts with medical helicopter companies. And so the patient gets these huge bills. Healthcare CEOs raked in $3.2 billion as the pandemic raged. They were laying off people in their hospitals because they weren't doing elective procedures, and their median pay went up $9 million during that year. Here's the range for the top people in healthcare, ranging from, now these are just their salaries. From 25 million, number 18 was down at 10. These don't include things such as stock options. Here's the CEOs of all these major health insurance companies. You can see Joe Swedish, before he took this job with Anthem, he was the CEO of the Centura Health System, I believe. And he was probably making 3, 4, 5 million there, but he took a significant pay raise to go with Anthem. Here's United Healthcare, 31 million. Here's the 2018 health insurance CEOs compensations. Where does this money come from? It comes from health insurance premiums. Or if it's a hospital chain CEO, it comes from hospital charges. And if it's a pharmaceutical company, it comes from prescription drug charges. Look at these salaries for the prescription pharmaceutical industry. The CEO's compensation in 2018. I mean, this guy's poor, 32 million, and this guy's 118. This is the Regeneron guy. And that's even gone up a lot more now. And can you imagine what Pfizer is making these days? With the billions of dollars they're now getting paid for their antibodies or their vaccines. But the all-time leader in this, we go back to the a little ways in the early 2000s, was a doctor named William McGuire. He was a doctor in Colorado Springs who became the CEO of then the young fledgling United Healthcare, which started buying up all kinds of other health insurance, smaller companies. And they did very well. When he left the company, he was there from 89 to 2006. He received a compensation in 2006 worth 1.6 billion. And these were primarily stock options. And then, but the Securities and Exchange Commission made him give back 600 billion. So I don't know if he ever could make it on only 1 billion. This is how outrageous this stuff has gone. This is a funny article. This was done by a group, I think an orthopedic surgical society, where they did a survey. Orthopedic surgeons are often among the highest paid doctors in any hospital. They did a survey comparing what's happening with the orthopedic surgeons' salaries compared to the hospital administrative executives. And they found out that the executives' pay was increased by 93%, while theirs was only out of 20, whatever the number is, I can't read it there, 26%. They were pretty upset that the executives were increasing their salaries by 4 times what the orthopedic surgeons were doing. Why does this happen? Well, because they can. Hospital administrators can pay themselves whatever they want. And when you say, well, how come you're making 2, 3, 4 million a year? They say, well, it's because that's what the competition is paying. And that's what the market going rate is for somebody as important as I am. And if they're a nonprofit hospital and they brought in more money than they spent that year, and they want to show that they're not making a profit on the books, they don't rebate the money to patients. They simply pay themselves more, they pay bonuses, or they build a new building, or they do whatever. And that's what's happening. It's pretty outrageous out there. Now, pharma abuse. Here we go, outrageous and rampant. Here's Moderna. The government gave Moderna 2 years ago, I guess it was a year and a half, $1 billion to help them doing their development of their drug, of their COVID vaccine. So they get $1 billion in subsidies, and they are now charging the highest price for their vaccine of any other vaccine maker. And they refuse, along with the other companies, to play ball when it comes to making their manufacturing patent available for poorer, underdeveloped countries to produce the same vaccine at a much lower cost. In 2018, 1/4 of all prescription drugs that were approved that year were priced over $30,000 for the year for the dosing. Here's how outrageous these drug prices are. I've never used any of these drugs because I never took care of these high-priced patients, except, I have hereditary angioedema. I saw a lot of these people in the ER where they would get swelling of their tongue and lips, and it was pretty scary for them. But again, to then get put on a medication to prevent this from happening that costs $600,000 a year, this is how crazy this stuff has gone. Hospitals charge for all the drugs that they give the patient, and that's certainly entitled to do that, but they mark up the prices from what they pay for the drug at least 5 times in most hospitals. This gets very complicated. This is the pharmacy benefit managers. These managers stand between the drug company and the pharmacies, or often the hospitals who are purchasing the drugs. And they siphon a huge amount of money out of the system. And it has to do with drug companies giving discounts and the benefit managers keeping discounts and not passing them on. I don't understand all this stuff, but we need to get rid of these people. We don't need this. It's just causing a lot of money, taking a lot of money out of the system and increasing the price of drugs. This is the old EpiPen outrage, when the cost went from about $40 or $50 overnight to $300, when one company purchased a smaller company who was producing these pens. This was funny because the CEO of the company that started charging $300 was hauled before a congressional hearing to explain why these costs rose so dramatically. And this lady happened to be the daughter of Senator Joe Manchin, from West Virginia. That was a fun hearing to watch. And again, they do this because they can. Here's one of the most outrageous things. This guy, Martin Shkreli, was a sleazy hedge fund manager who bought a small drug company that was the only company manufacturing this drug called Daraprim, which I believe was an anti-parasitic medication, and it could, the disease that it treated could happen in people who are immunocompromised, particularly HIV positive patients. And he raised the price of this drug from $13.50 to $750 overnight. And the reason he did it is because he can. There's nobody to control what he charges or his company charges. And this guy was really sleazy. He's now in jail, but he's not in jail because of what he did here. He's in jail for some other type of fraud that he committed after he bought this drug company. This stuff is just outrageous. And now we have generic drugs that are being priced out of control. And the reason is large drug companies are buying up smaller companies that have been manufacturing generics, and they get control of all the manufacturing, and they just raise the price. And there are some suits brought by states' attorneys generals, I believe, because they believe there are inflating these prices and their companies are colluding with each other. Anyway, price fixing. It's and the other thing that happens is a drug is a brand name drug. And so for 13 years or as long as the patent lasts, the drug company can charge very high charges for that drug. As soon as it becomes generic, the price drops dramatically. And often it's a smaller pharmaceutical company that will produce the generics. And so before this happens, the large company will buy the small company to prevent them from producing the generics. So that's where we're at with outrageous abuse in pharma, in hospitals, in providers. And it's basically, they do this because they can. There's nobody controlling the cost, except Medicare does control some of these charges, but not all of them. So what are the impediments to healthcare reform? Well, the big one is right here, the special interest, the medical industrial complex dollars, okay? We hear a lot about the defense industrial complex, which is significant too, but this medical industrial complex has it beaten. What many consider waste and abuse, as we've just been talking about, these special interests consider salary and profit. They make huge contributions to our legislators at all levels, federal and state. And this one, I don't know if we're ever going to get here, but the unwillingness of our legislators to work together for the public good. I mean, they've been talking about allowing Medicare to negotiate prescription drugs for years, but they haven't done it yet. Here is just the contrast. The red bar is the medical industrial complex. The blue bars are Fortune 500 or major lobbying companies such as business association, computers, oil, gas, real estate. Medical industrial complex dwarf these other companies because they're looking at a pot of $4 trillion that they want to continue their revenue stream from. And the way they do it is by lobbying. And this is an older slide of the amount of money from this medical industrial complex to campaign officials. So I went to opensecrets.org, which is the site to go to find out how much any legislator has gotten in contributions from any special interest group. And here are the top providers of this money for the medical industrial complex. And the top person is interesting, Carla Jerviston. I said, who the heck is this? It turns out she's a psychiatrist who is married to a very wealthy guy who made his fortunes, billions in Silicon Valley. And so she now is a liberal activist and donating to liberal causes. And this is just for medical stuff, the medical industrial complex. But you can see United Health Group is in here, Blue Cross Blue Shield, several drug companies, Kaiser, a lot of special interest companies. Here is the 2020 campaign, contributions from the medical industrial complex. You can see both Biden and Trump did very well. Biden got more than Trump there. And then, of course, you can see the senators, and the contributions they've received. And here is, that's the same thing. Here is, there should have been a slide. Yeah, here's the representatives. And they did pretty well too, from Steve Scalise with 2 million all the way down to number 20 got to 500,000. And they're equal opportunity special interest donations, Democrats and Republicans. They're usually the leaders of key committees or the leaders in the House and Senate. In fact, Schumer did real well here. Where is he? Maybe he's in the next one. There he is. So Schumer's at the top here. So anyway, and then I went and I said, well, what are our senators getting from the medical industrial complex? The person who got defeated by Hickenlooper, I'm blocking on his name, he got over $1 million for his 2020 campaign. What's his name?
Cory Gardner.
Cory Gardner, yeah, he got over $1 million. But Senator Bennett from Pharma, this is for his 2020 during the 2020 campaign year, 569,000, health professionals, 557, hospitals and nursing homes, 245, and he had a total of 1.4 million basically from the medical industrial complex. I'm sure Hickenlooper will be exactly this, almost the same. And if these guys were heads of major committees in the Senate, that would be even higher. And this is again from Open Secrets. So this is the problem. This is the big problem in how do we get to healthcare reform when all of this money is being funneled to influence legislatures who would have to make the major decisions and pass the legislation to reform healthcare. It's really tough. But I think it's going to be done because we're reaching a tipping point where healthcare is simply unaffordable, as we demonstrated a week or two ago, to the average person. And if unless we continue to give huge taxpayer subsidies to the insurance companies, the thing that's really going to tip it over is, even though the subsidies could make health insurance premiums low for many people, they don't take away the copays, the deductibles, and the surprise medical bills. Medicare doesn't have any of those things. They have copays and deductibles that are a little more reasonable. They need to be fixed, but there's no surprise medical bills if you're on Medicare. Here is, let's see where we are. I got it. Yep. So we need to fix Congress, huh? What can we do now to control the cost? What can we advocate for? We can demand that our legislators, should be legislators, I'm sorry, Colorado, why don't they reinstitute a certificate of need? Or have a federal certificate of need? Because a special interest won't allow them to do it. Make public all hospital charge masters to be able to compare side-by-side prices. And then you could put the $92,000 appendectomy hospital alongside the $22,000 one, make it public and let them stand up and justify why they charge so much. We should make public all, not just health insurance company and pharma's CEO salaries, but every hospital's CEO, and not only the CEO, but their associates who are pulling down hundreds of thousands of dollars in salaries. And then make them justify these huge salaries and compare them to the average employee, the nurses, the healthcare techs, the people who make the hospital run, compare their salaries to those of the CEOs and the administrators and let them stand up and justify them. We should allow Medicare to negotiate drug prices. That would save $55 billion a year. It's estimated over 10 years, if Medicare could negotiate 10 years, they would save $550 billion. So that's $55 billion a year. We need to reform the drug patent laws to curb the abuse by pharma of keeping drugs on patent, not for 13 years, but sometimes doubling it by taking the same drug, preparing it as an extended release formulation and getting a new patent. These patents just allow for abuse. We need to prohibit direct marketing of drugs to consumers. That drives up the cost dramatically, and just the cost of doing the marketing. Let's pass this back to the consumer and make the cost of drugs less. And this direct marketing should have never occurred, but it's there and it should stop. So that's basically my rant for today. Go back here. Thank you on behalf of the Healthcare for All Colorado Foundation. And this is a cartoon I just found.
Isn't that the
Any
truth?
questions
Please,
or
yeah,
comments?
please feel free to unmute if you'd like to make a question, make a comment, ask a question. You can unmute yourself. Debbie, did you want to say something?
No, I just unmuted myself in case I changed my mind.
Okay. Some great comments, Vince, in the comments. I'm more upset. You've updated a lot of these numbers, and it's so upsetting. It seems like it's at every level of healthcare now, the waste, fraud, and abuse. It's upsetting.
Yeah, it's permeated every level of healthcare. It's everywhere. And there are ways to try and get some control of this, not all of it. And we'll talk about those next week.
Yeah, the thing that bothers me the most is the infiltration of the equity firms in taking over healthcare, and that type of thing. It's it really is nothing but a money extraction business, and your health doesn't even really enter into it anymore. Every time I go to my doctor's office, before I even get checked in, they want the copay, and I keep telling them, but I'm not at McDonald's.
Yeah, isn't that the truth?
I pay after I get the service. Well, you're getting a service today, but I haven't gotten it. And what if I'm dissatisfied with the service I get?
Good points.
They don't
Hunter?
know how to answer me.
No, I'm sure not. Hunter, did you want to ask a question or make a comment?
No, I just appreciate Vince's efforts to enlighten us on all these things. He's pulled a lot of stuff together and really makes us think. So.
Absolutely. And I hope that we will all take it upon ourselves to share the slides and the video with as many people as possible. If I, who follow this very closely, I'm still horrified by what I see in these slides. Imagine what most patients and other providers, sometimes providers don't know it either. So I think if we can all take it upon ourselves, even if it's just one other person, share it with them. Let's push this.
Well,
out
I hope people will educate their friends and family and neighbors on what the facts are,
there. Yeah.
because the special interests are so good at framing stuff and you know, misinformation or just flat out untruths about this stuff, just to preserve their huge, very lucrative existence.
Yeah. As a dear friend of mine used to say, the profits are dear. And they watch them closely. And it's Vince, thank you so much for enlightening us all. And we're going to look forward to our 4th in the series, and we will get more of these videos out to you so you can share them with friends. And we will have the PowerPoints available. Shelley, I have forwarded the link to tonight's National versus United call. They're going to be talking about Medicare for All, and Bernie Sanders is slated to be on the call if folks are interested. Thank you all for being here, and we'll see you next week.
Thank
Hey,
you.
Don, before we leave,
Bye.
I have a question.
Oh, Don, I'm sorry.
Don, yeah.
Question, yeah, for you and Vince. When you first got connected to Healthcare for All Colorado, you came in with your personal story of bankruptcy or near bankruptcy as a result of medical bills. Is this situation currently a problem? Has it increased? Has it grown over the years?
As a patient who watches, so Don, thanks for that question. I do watch the statistics on bankruptcy, personal bankruptcy, and we did indeed go all the way to bankruptcy. And we have always felt ashamed about that, ashamed that we couldn't afford healthcare, even though we always had insurance. The statistics are roughly the same. About 2/3 of the bankruptcies that are filed in the United States, it's done so because of medical debt and medical costs. And it looks to be about 700,000 Americans every year. Every year. That's a real loss to our economy of what could be spent in other sectors of the economy. The other thing that's got a real chilling effect on so many families seeking necessary care. And they wonder why we don't get preventative care, why we don't go seek care earlier. Much of it is because of cost and what we fear from the billing on the back end. And Vince, you may want to add to that.
Yeah, the COVID bills are coming due now, and people who have lost their health insurance because they lost their job. And this is going to accelerate the number of bankruptcies, because these bills are going to be incredible if they spend any time in the hospital, particularly the ICU. And the other thing is the private equity taking over healthcare and causing so many more surprise medical bills through their outrageous charges. That's going to increase personal bankruptcy. And that's why I think we're going to reach a tipping point. Something's going to have to be done to put a stop to all of this, because no other country in the world, developed country, has people go bankrupt because they can't pay a medical bill. It just doesn't happen, because they've created universal health care that basically will cover everybody. So that's where we're at. We're going to talk about how we're going to fix everything next week.
Awesome. Thank you, Vince. And thank you all for joining us, Don and Hunter and Debbie and Shelley, and Eleanor was on earlier. We'll hear from Eleanor a little next week. So thank you all and good night.
Thanks. See you next week.
Thanks. That was a great talk. Thank you.